Know about treatment history, what's worked in the past, what hasn't worked, and also making sure that if people have had treatment before, that the treatment they've had is an adequate dose. So if people have been on an SSRI but the dosage was too low or they weren't on it long enough, then we'd have to consider them as not really tried that SSRI yet. We might want to try it again. Same with cognitive behavioral therapy. People will sometimes say that they had cognitive behavioral therapy, and with a little bit of probing, you find out they didn't really do any of the homework, or they only had one session, or they had the wrong kind of behavioral treatment. So we know that relaxation training, for example, progressive muscle relaxation, is a fairly effective treatment for generalized anxiety and worry and stress management. But for OCD specifically, it doesn't seem to do a lot. So we want to make sure that the people have tried the strategies that have been found to be most effective, which we'll talk about throughout the rest of the day. The role of the family. Are there things that family members are doing to contribute to the OCD in some way? So we call that accommodation. In the substance use literature, substance abuse literature, they refer to that as enabling. You know, when your spouse is trying to quit drinking and you want them to quit drinking, but you also know they really love scotch, so for their birthday you buy them a bottle of scotch every year. That would be an example of enabling. In OCD we see family accommodation as well, where family members may buy the soap that the person needs to wash their hands excessively, for example. So we'll talk more about that later in the workshop. Is it possible for family members to help with the treatment? So for example, doing practices with the person. So one thing that we see sometimes in OCD is excessive reassurance seeking. So the person with OCD will ask the family member for reassurance about some issue. I'm not a pedophile, right? Or the door is locked, right? And the family member will give that reassurance over and over again, which just helps to keep the problem alive. So we may need to actually include family members in the treatment, which again we'll talk about later. It's good to know about the family history of the problem. Is there a family history? Do other people in the family have the problem? And medical history, and not just past medical history, but any current medical issues that may be complicating the problem or contributing to the problem. So let's talk about monitoring diaries. So these are forms that people would fill out on a regular basis to monitor different variables of interest. And it's important to have people monitoring their progress, monitoring their symptoms on an ongoing basis for a few reasons. One is that people's memories are not great. So if you have people, if you just ask them at the session, you know, how many times they wash their hands or whatever, they'll often not remember. If they're having a very good day, they might remember the whole week as being better than it was. If they're having a very, very bad day, they might remember the whole week as being worse than it was. And generally, the information just won't be very accurate. So for example, if I were to ask all of you, today's Thursday, what you had for lunch on Tuesday, how many people remember? Okay, not very many. About the same. It's probably the same people who are able to suppress the white elephant thoughts. It's around the same number of people. So, and I didn't even know what day it was for a second, let alone what I had for lunch 2 days ago. So we often don't remember those kinds of details, and yet we ask our clients to remember all kinds of details from a week ago, from a month ago, and so on.